The advice and opinions expressed by Dr. Granpeesheh and her guests are meant solely as suggestion and should not be in any way construed as child-specific advice.
Dr. Doreen Granpeesheh is the
Dr. Doreen is an expert in autism.
Doreen Granpeesheh.
Dr. Granpeesheh.
Dr. Doreen Granpeesheh.
Dr. Doreen Granpeesheh is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen.
Good morning and welcome to Ask Dr. Doreen. I'm Shannon Penrod and look who I'm here with live.
Good morning, Shannon.
Good morning. I'm here with Dr. Doreen Granpeesheh. She is the Doreen in the Ask Dr. Doreen, and she is a true expert in the field of autism. She's been working in this field for more than 45 years. Are we at that point where we're saying that?
Yeah.
That's crazy. I know. She doesn't look like it. Looks like she came out of the womb and started practicing. That's not what happened, but we'll let you all figure out the math on that. But she is a true expert in the field of autism. I don't know anyone in this field, and I've interviewed a lot of people in the last 18 years. I don't know anyone who is more concerned about the well-being of individuals on the spectrum, what they need, what their personal human experiences. I don't know anybody who's more concerned about that than Dr. Granpeesheh is.
Thank you.
It's the highest compliment I can give. It really is. And you're the best at perspective taking that I've ever seen, because she not only considers the individual on the spectrum, but also taking care of the families around them to support them so that they can be better allies and support to the individual on the spectrum. So we're thrilled that she donates this hour every week so that you guys around the world can ask questions. So we hope that you'll write in right now. We're live on Facebook, YouTube, Twitter, and about a dozen other places. Our wonderful Chris Desmond, I found out this morning that when I say Chris Desmond, the AI says Chris Jasmine.
Oh, interesting.
So I'm trying to, Chris Desmond. He is our wonderful producer, and he's going to be showing you things on the screen, places that you could be listening or watching the show. I will remind, especially all of those who are listening to us on podcast, or maybe you haven't found us on podcast yet, we are a free download wherever you get your podcast. Ask Dr. Doreen is its very own podcast now. So you can go, there's an Ask Dr. Doreen YouTube page, there is an Ask Dr. Doreen website. You can go to all of those. In fact, you can write in on the website some of our starter questions we get from that weekly. It's a great place to write because you have that maintained by the fabulous Marina, who is just on it. So much better than I could ever be. So, and she makes sure that I get your questions. So we hope that you'll check all that out. We also want you to know that when you are downloading, and so many of you are listening to us in podcasts, and we really love that. We hope that you will embrace the wonderful sponsors that are making that possible for you to download it for free. There are ads that will play on the podcast. If that really fututses you, I don't know if fututses is right, but if that really tears your ticket and you're like, I really want to listen to this without the ads, there is a way that you can do that. It does come with a small monthly charge. It's $5 a month, even less if you pay for it for the year. What you will do is go to glow, GLOW, .fm/autism live. When you go there, you'll be able to, for that small monthly fee, you get everything the Autism Network does. That includes Ask Dr. Doreen, Autism Live, and all the extra shows and all the baby podcasts that we're trying to birth. So we're an incubator now, which is a very fun thing. So I hope you will check all that out. We are going to get started, and our topic today is anxiety, autism, and ODD. Ooh, let that fly around the room for a minute. But we want you to know we'll take questions on absolutely any topic. You can be writing in right now. In fact, I want to say good morning to Rodney. I'm saying good morning to Andrea, and good morning to Amanda. Look, I'm so thrilled to see all of you and your blue hearts, Amanda. So feel free to write in right now, and we'll be able to get to as many questions as possible. I do like to remind you of a couple of things. It seems like we get to the half hour, and that's when everybody starts to write in. Yes. And you can literally watch my blood pressure go up as I'm like, we're not going to get to all of them. So, try to keep me alive a little bit longer by writing in sooner. Just asking, you can only say no, right? Good morning, Helen, and good morning, Eric. So thrilled that you guys are all here with us. So ask early and often. Be patient. I'm doing the best I can. I don't have my fake glasses today, so let's see if I can see without my... I literally think I see better with my fake glasses, as I've convinced myself. Anyway, that's... I'm telling you, I literally will put my fake glasses. Does everybody know I wear? It's clear. And I'm like, oh, I can see better. I think it confines my vision. Anyway, does everybody know I wear fake glasses? I pop the lenses out because there was too much shine on them, and so I popped them out, and I forgot them this morning. So there we have it. Now you know everything that you need to know. TMI. Okay, so what are we doing? Can I also say that I forget lately to give the disclaimer that there is no expert in any field who can give individual specific advice in this format. That would just be wonka-noodle, because the person doesn't have the ability to see the individual and have eyes on the situation. Having said that, we all know that Dr. Granpeesheh is truly the amazing expert in the field of autism, and if you'll send in as much information as possible, what happens often is she will ask you more questions. Occasionally I ask more questions, and then you can pick her wonderful brain to go back to the expert who does have eyes on the situation. Does that work for everybody? Because those are sort of the rules. Okay. I see that question. I'm going to get to that in just a second, Amanda. The other thing I want to say is we are less than a week away now of April, and we're calling April the 3 A's, but I'm considering adding the 4th A. So autism awareness, autism acceptance, autism action, and then lately I've been hearing appreciation. So want to hear from you guys how you guys think about that. How many A words can we pack into the month for April? But we have guests galore. Just to give you an idea of some of the people that are going to be joining us during the month, obviously Dr. Granpeesheh, but in that first week we have Dr. Stephen Shore, who's coming with us. We've got Julie Matthews. I know. Kobe Bird is going to be with us. I'll tell you who's going to be on in April for the first time. We've had her on in her music video, but we've never actually had her on. Abby from Love on the Spectrum USA.
Nice,
So
nice.
she and her mom are going to be here with us, and so many more experts. It's going to be off the chain, as you young people say. I think they said that 20 years ago. I think I just really off the chain. I think I really dated myself. It's because I don't have my glasses, you guys. Okay, so today we're talking about anxiety, autism, and ODD, and I want to get started with this first question that was written into us. My son is leaving school in June of this year, age 19. He currently attends a school for severe learning disabilities and is diagnosed with autism, ADHD, and anxiety. There will be a break over the summer, and then he will enroll in a learning resource center. He has already been to visit it and has met the staff and knows some of the participants who attend. I have noticed a big increase in his anxiety over the last months. He is verbal and he has been able to talk about his worries. However, his OCD has become worse. I just wonder if this is a sign that there is much more going on with his anxiety. If he moves anything, he has to go back and move it again a specific number of times. I've had incidents where we have gotten into the car, but he has gotten out again to fix a mat at our front door, which has to be done a number of times. If anyone touches him, he has to rub his arm after being touched. He also has a verbal script, which is repeated a lot during the day, especially when we get ready for school in the morning. He already takes 20 mgs of fluoxetine daily. Previously, we did change to another medication for OCD, but it made him more anxious and angrier, so we went back to fluoxetine. I'm just at a loss as what to do to try and help him. Any suggestions would be so much appreciated. And we're saying big hug to our friend, our Ireland friend.
Yes, yes. So, first of all, you're doing everything right. You just need to persist a little bit more and tweak a few things. So I'll talk about that. It's absolutely, totally natural for him to be experiencing anxiety. He's going into a whole new environment. He's stopping doing something that he's done all of his life, school, and now he's going to be in a very new environment, new people, new routine, new challenges, whatever it might be. So he is apprehensive, and this is increasing his anxiety, and increased anxiety will always correlate highly to increase in OCD, obsessive compulsive types of behavior. Because when you think about it, an obsessive compulsive disorder, OCD, used to actually be under the anxiety chapter in the diagnostic manual. It used to be one of the anxiety disorders. They separated it and gave it its own heading and chapter because it has become so prevalent. But this does not mean that it is not related to anxiety. It very highly is. So it goes back to and this is what I was going to say, is that the reason anxiety and OCD are so highly correlated is that in obsessive compulsive disorder, when you have an obsession, it's really interesting if you analyze this. When you have a thought that is an obsession, that's the obsessive portion of OCD, it's an anxiety-provoking thought, and then you do the compulsion, the compulsive behavior, in order to control that anxiety. That's what OCD is. So I have a thought about there are germs on my body, and I have to swipe them away or wash my hands or whatever it is in order to get control of that very intrusive thought, okay? And it could be, the compulsions don't necessarily make sense at all, ever. Like, you know, you could have a obsessive thought about, I don't know, I'm not safe in this environment, and then your compulsion could be, I have to look at 5 objects in the room in order to kind of make things safe. They're not thoughts, the compulsions are not necessarily logical, I want to put it that way. But the fact that he has these OCD things increasing makes completely sense. So you have to do a few different things. One is, just to make things tolerable for right now, go back and talk to his physician, his psychiatrist, and discuss the medication. Fluoxetine is great. Maybe he needs an increase in dose. You can often increase dosage on SSRIs, and then later when you want, you can gradually decrease them. So that's one idea. The other idea is there are additional things that can be given in addition to the fluoxetine that might help curb the current kind of acute increase in anxiety, just to help him manage a little bit for the next, let's say 4 months, 5 months or so, maybe 6 months, because you got to get him through the summer, right? So he's already started being apprehensive of something that's going to happen after the summer, and we're not even close to the summer yet. So you have like 6 months period of time where you want to really help him. What are other things you can do? I would really start focusing on what are the things that make him anxious about the new place. Perhaps if you can, after school or whenever there's a possibility you have to work it out with the new place, take him there frequently, go there. Familiarity reduces anxiety. So the more familiar he becomes with the new place, the less he's going to be anxious about it. Follow the routine that he would have and make it super, super fun. Like, first we're going to go do this, and then, or get a teacher or someone from the new location, not a teacher, probably like someone in resource or whatever, you know, a vocational helper or whatever they might be called, and have them accompany him and have him do something in that new place that makes it his. He could help paint the walls. He could help clean up the location. He could help organize the materials. Something that makes it feel like, oh, this is kind of my place. I belong here. I'm going to know this place better than anyone else. Like, help him become very comfortable and familiar in that space. And talk to him about what he's worried about, because a lot of times our kids will be able to tell us what they're worried about. And believe it or not, it's going to be very normal stuff. Like, you know, I'm worried I'm going to fail. I'm worried I'm going to be embarrassed in front of other people. I'm worried people are going to make fun of me. I'm worried I won't understand what the instructions are. I don't know what to do. So all of those things are ways that you can help him calm. Now, in addition to that, you can also give him some exercises that will help him calm down right now. So whenever he has the need to do some sort of obsessive thing, that's okay. You don't want to get in the way of the obsessive routine, but you can also, in addition to that, practice things like, let's meditate. Let's sit together and meditate and breathe in the morning especially. There's a lot of cognitive behavior therapy exercises that can help. I want to talk about this a little bit because it's going to come up in anything related to anxiety, really. There's a multitude of different interventions for anxiety, but the one that I feel is the most effective is the whole concept of, excuse me, cognitive behavior therapy. And that starts with the idea that the things that cause us anxiety are thoughts. If we can control our thoughts, we can control how we feel about the anxiety that's going to be, resulting from our thoughts. So the concept with CBT is you're supposed to question, you're supposed to be aware of your own thoughts and then question them. For example, when I think about my new job or placement, I feel anxious because I think I will fail. So the thought is, I will fail. And then you sit and you question, why do you think you will fail? And let's figure out, A, practically what things we need to do to make sure you don't fail, but also B, what are the faulty, what we call cognitive distortions? What are the faulty things that are going on in your head? Like, do you think you'll fail because you've had lots of situations where you failed? Have you ever failed in this situation? How do you know that you're going to fail? So CBT generally works as long as you have kind of the ability to really be aware of your own thoughts and to analyze your own thoughts. And a lot of exercises go with CBT as well. For instance, waking up in the morning and writing down all of your negative thoughts that pop into your head during the course of the day. And then in the evening, making sure that you reverse them or question every single one. Like, what makes me think I might fail? What if I don't fail? What are the odds that I won't fail? What if I find people there who are going to be nicer to me than I've ever known in my life? So questioning and making sure that you also open your mind to the possibility of things actually working out instead of things failing. Yeah. So those are some things. So CBT exercises, just familiarity with the location, and making sure that you're on the right meds. I think those will get you through.
Can I list 2 extra resources that I'm aware of?
Please, yes.
So I think we've talked about it before here, that I have OCD that's really well managed now.
Yeah.
I say that laughingly and sarcastically because sometimes it's not.
Yeah.
Do you know? And what I love is that now there are times when I will pull the car out of our driveway and I'll stop it and I'll go and I'll check the door and I come back and I have to go and check the door again. Mm-hmm. And I have to do it like 3 times, and sometimes I have to go in and check the stove too. Right. And now when I do that, and it may be a couple of times a year that I do this, my son will always say to me, "What's really going on?"
Yeah, yeah.
And I go, "Oh, okay, what's really going on?" Because in the moment I don't notice. Yeah. I just notice that I'm worried, did I lock the door? And I go and lock the door, but I'm so worried about something else, I don't notice if I lock the door, which is why I have to go back and back. Anyway, so best thing that somebody had me get, and I wish I could tell you what the author of it is, but it's a big workbook that it's the Panic Disorder and OCD workbook, and it's got exercises in it. And I buy them on a regular basis, and then I end up giving them away. So I bought so many of them. Now I don't have one right now to tell you who the author is. But it's a big book with like a green outline. I think it's got like maroon letters on it. But the other book that I really like, and we've had him on the show before, is Dr. Jed Baker. He wrote...
I gotta write that one down and order it.
Oh my gosh, I really love this book. He wrote the book Treating Anxiety in... Children and Teens. Now, it is not for individuals that are on the spectrum, but there is a chapter that is devoted to it. But the main principles of it, what I love about it is he says, all the things that you just said, he said, these are known things. And you can go read the book on that. But his thing is because he's treated a lot of teens, and he says their experience is their experience, and they don't know that they could feel better. Mm-hmm. So why would they work through something? Because you have to get a little uncomfortable to work on something. They have no skin in the game because they can't picture their life being better. They feel how they feel. So his book is really devoted to how to make it so that they'll want to work on it. Yeah. Which is really, really important.
Yeah, it is.
Because if you're not in a place where you think you can get better,
you're just not going to know that there is a better place. Yeah. And the thing is, Shannon, that a lot of times, especially with teens, because they're, very emotional, hormones raging, all that sort of stuff. And what happens is when you have a feeling, just like our thoughts, the whole concept of CBT is your thoughts can influence your feelings.
Yes.
The reverse is true as well.
Yes.
When you feel anxious, and this is something very important for our kids, because I feel a lot of times without sleep and with GI discomfort and all the other things our kids go through, they do feel uncomfortable, and they attribute that uncomfortable feeling to a thought. So what happens is they think like, I feel really anxious right now. It must have to do with this new place, right? So the feeling of anxiety then gets connected to something that's happening in their life that's new. That wouldn't necessarily be the case. So it goes both ways. Our thoughts influence our feelings, and we label, or we take our feelings and label thoughts from them. So you have to be very careful about that.
Absolutely. There are so many things that have been written in that we're going to get back to. But I
Great.
do want to address, because this goes hand in hand with what we're talking about. Eric says, also, we struggle with perfection. And this is an area
That's a big part of it.
big part. He said they must do everything perfect. If not, they may have a rough
Yes,
time.
That's right.
Uh,
That's actually why, Eric, one of our lessons, we learned this very early with a lot of our kids, and one of the lessons that we wrote in the beginning was the gray area, right? Because a lot of kids have black or white thinking. This is actually one of the cognitive distortions have names, all of them, and there's like 20 of them. One of them is black or white thinking, and black or white thinking is that things have to be 100% perfect or they're 100% failure. And being able to see that gray area is incredibly valuable to anyone, everyone. It's like, think about it, like you try to exercise, and today you get 3,000 steps in instead of 10,000. Is that a failure, or is that okay? It's progress, right? So like just changing the way you think about things and noticing that you are gradually getting to the things that you consider to be the utmost best is life-changing when you look at it that way.
Absolutely. Okay, I want to get to some of these questions that have come in. Amanda wants to know, are there any tips for getting started with CARD with a teenager? He's going to be 15, or he is 15, and that they cannot wait to get started. I'm very excited for you, Amanda.
Yeah, so am I, Amanda, and we should probably try to talk off screen, because if I remember, you are in the Houston area?
Yeah.
Yeah, and so we should probably talk and try to figure out how we can help you, because I'm not quite sure what's happening with that particular site, but I do know we have staff on the ground in Houston.
Well, here's the other fun thing, is that I'm with a group of people now that have an orientation. When you're at a certain point in the pipeline, then you get to be with myself and Vince Redman and Lisa Bancroft, and you get to spend some serious time with us, and we'll help you to get ready. So
yeah, but Amanda being one of our known friends,
yes,
we need to figure out how to get you into the admissions portal and how to get you started.
Yeah, I'll catch up with you, and we'll figure out where you are and make sure that everything's going just right. But I want to say this, that's not unusual. Like, I don't want anybody to think, oh, well, of course Amanda is family, right?
Yeah.
But we would do that for anybody.
Anybody. I mean, right now we're doing everything we can to get about 100 kids started every month. It's a lot of kids coming into our portal. And I just want to make sure that people realize I have not allowed CARD to refuse any age. So whether your child is 15 or 2, it doesn't matter to me. If you want our support, we're here to support you. It's just a matter of getting your funding in place, getting a team together for you, doing all of your parent training, and getting you started.
But I'm going to get emotional for just a second and say that I'm so proud of you.
Oh, thank you.
And I'm so proud that, that I'm back working at CARD, but I'm so proud of you. And I always say this whenever people ask me about you, that you are the real deal, and that I've been in the room many times when there's been a difficult decision to be made, and you always take the side of the kiddos.
Yeah,
and
sure.
the families.
Absolutely.
And I just, it makes me very emotional, but I'm very proud to know you,
Thank
and I'm
you,
proud
thank
of the
you.
work that you continue to
Thank
do.
you, thank you.
And then I'm going to mop down.
Oh.
See, the glasses
you.
cover some of that. Anyway, okay, and I mean that sincerely. Okay, Andrea has got a big, long question here. She says, currently I'm looking for a new ABA provider. Unfortunately, I'm struggling with my current provider, who I used to think was great. Anyways, while I'm on the wait list, I have kept him current on his ABA. But they went on to say one of the reasons why, on his ABA setting. Here's my question. I asked my BCBA if she could work on teaching my son how to wipe after he has a BM. And she explained that that is not her job. And it's a parent's job, which is fine. I will do it, but could you give me some ideas on how to do this? He refuses. I've tried reinforcers and all. He needs to be independent in the bathroom before preschool.
How old is he? I thought he was, I didn't realize that you have such a little guy, Andrea, now that you mentioned preschool. But yeah, okay, so this is a little guy. A lot of our staff do these types of things as part of our toilet training procedure, and we do teach our kids how to wipe. If this particular BCBA doesn't really want to do that, yes, then they absolutely need to teach you how to do that. And I would recommend lots of different things. First of all, you have to make it fun. I would use wet wipes if possible, because that's going to make things a lot easier. There's a lot of different, just many things popped into my mind right now about this. So you can use a doll to help your child understand kind of the anatomy of it. I saw a video one time of a teacher. Do you remember this, Shannon?
Yes, I know exactly what you're going to talk about because I loved it.
I know, me too. Where I think she had balloons or something that were on a chair, and she was trying to show kids how to wipe by going in between the balloons. You should probably look that up, because I think when you make things a lot more fun for our kids, they really get the idea, and then every time they do it, they kind of giggle because it's like a fun thing. They're imitating a video. This video is online. It's on YouTube, I think, of a teacher showing kids how to wipe. That's what I would look up. And that is probably the best video I've seen, because it really does make the whole thing kind of into a game. But at the same time, it's extremely effective, and it's exactly what you want to show your child how to wipe. But then remember, whatever, you're shaping this behavior. So you can also, for instance, do a backward shaping procedure where you help your child put their hand in the right place and then let them finish. You want to make sure you reward as much as you can when your child is trying to do this type of thing, because it's a new thing, right? And so those are some ideas there. But yeah, certainly your BCBA should be giving you ideas about this.
Yes, I mean, I just want to say that about it. You're so kind and you're so professional, and I just don't understand the BCBA's position at all.
It's so strange,
you know, I mean, it's one of those things that it's just to negate and go, oh, that's not my job.
That's
ABA is supposed to teach, help you to have your child be in the world. What, he doesn't poop on your time? I don't know. I don't understand that. But yes, that video with the teacher, I love it.
I love that video.
She sits with her back to the students. So the students' view, they're looking at her back, and on the back of the chair are the two balloons. And I think actually the video is trying to teach not being wasteful of paper. But it's a great thing, because she takes the paper and she holds it up and she reaches and wipes between the balloons, and then she folds the paper over to show you can now still use. So I don't, I do think that that's what she's actually trying to show, is that one piece of paper can get you 3 wipes.
Yes.
But
don't worry about that.
Don't worry about that part of it, but it's brilliant.
And definitely use a wet wipe, like what are they, dude wipes or wet wipes, because they make a
flushable wipes.
Huge difference for our kids.
It makes it so much more pleasant. Okay, so wonderful. But we also had a question about the rules regarding potty training in kindergarten. Can a student be in gen ed kindergarten classroom with a health aide to provide bathroom assistance, to include helping them in the potty and dressing and undressing? I think that, yes, and that's something you need to get written into your child's IEP. But the school should be providing assistance with that sort of stuff. It's,
You know, depending on the school, you might have a little bit of a battle on your hands, but realistically, they can't say you cannot come, your child cannot come unless they are 100% with all the assistance in the bathroom. They should be able to provide assistance with that.
What they will say, though, often is that that they need to be in a different classroom because they're trying to save on aids. The thing that I would encourage you to do is, here we are, it's March, and what I'm asking all of the parents to do is plan for the summer. Like, really get your list on of what you want to get done in the summer. How do you want to make the most of the summer? Be talking to your ABA providers about, here's what I want to tackle during the summer. And it's different for everybody.
It's true.
I remember the one family that we had that they had a daughter who was considered the severest of the severe. And I remember being on the phone with a mom and saying, what would make you really happy? And she said, I'll tell you what would make a big difference is if she could walk foot over foot. And this was an 11-year-old girl who could not walk foot over foot to go upstairs. You know how when our kids are little, they put 1 foot, 1 foot, and then one foot, 1
so
foot.
alternating.
And it just was taking a long time.
Yeah.
And so she said that would make a big difference. But the child was going to school. Nothing was being accomplished at school with this 11-year-old. And I said, can we please
work on this
Can we
over the summer.
please have every hour that you can use, can you make them so available? Don't go on vacation. Let's come up with 3 things that would be meaningful. And she said, I don't even want to come up with 3. If they can teach her foot over foot, I said, they just need hours to do that. That's not something they're going to teach her in 5 minutes. They just need hours to do it. And I got her to agree to 3 months that they were going to go all in. And after a week, she called me and said, oh my God, I didn't think this was possible. Then she was allowed to dream about, here are the next things I want to do. And I'll tell you that mom made the decision when the fall came around that she wasn't going to go to school. They got the note written out. She had really intensive ABA at 11 for another 6 months, and then went back into school with an aide, and it was a different world.
It was a different world.
So I put that as an example to you guys. Summer is a long, long time, and if you have the ability to intensify your ABA and get specific about what would be meaningful to you, but the potty training thing, I would get all over that for the summer.
Agreed. It's a
so
good
that it becomes a
activity.
non-issue. You don't want to have the argument, because school will use it as an argument to say, well, we'll give you the A, but they've got to go to special day class. If it's the thing holding your child back from being in a gen ed class, my personal feeling is let's get all up over it.
Absolutely.
Thank you for not thinking I'm crazy. I appreciate it always. Okay, so next question that I want, Lucy has written in a couple of times and asked about how often does the DSM update, and how often do the prevalence numbers?
The CDC autism statistics, is that the one you're talking about?
Because she wrote 2. One about the CDC
my
autism
gosh.
and then the DSM.
Yeah, Lucy, these are great questions. So the CDC and the DSM both are random times. There's no schedule at all. So the DSM hasn't been updated in ages. What was it, 2000, I want to say 15? No, or 13? I'm trying to remember when the DSM...
I want to say 13, but maybe it was 14. Maybe it's
so it's been
right
a
around
while.
there. Yeah.
So it's over 10 years. There's no set... it's not supposed to come out every... it could go 20 years, it could go 3 years. They've come out at different times. So when I started, I was on the DSM-3, and then it became DSM-4, and then it became 4R, and then it became the 5. And so that's over the course of the last 40 years or 45 years or so. So it'll vary. We don't know. In terms of the CDC stats, they are also random. And unfortunately with the CDC stats, whenever they come out, they also have to do with data that's multiple years old. So the last CDC stats that came out, I believe, came out in like 2022, and they had to do with data that was from 2018. So it's multiple years later, because it does take a while for the CDC to track all the data, measure it, and figure out what it all means. So that is unfortunate, but that's the way that it is.
I just want to say, Paula, I see that you've joined, and I hope you were here when we answered your question. If not, rewind, because we did answer your question. It was the first question that we answered. I also want to get to Eric, who asked about the perfection thing, but earlier Eric had said, my twins are 8. Boys always have to have things in pairs. When he doesn't, it's very difficult for him to cope. On the other hand, his twin doesn't like, for example, electronics to die or to be too low. It's a struggle when it does die or it's not charged properly. Do you think we should worry about these events? And then later he had brought up the thing about the perfection. So
you
the
don't need
twins
to
and
worry about, like, worry is just an overt expression of anxiety. So, no, but I would, if it starts to interfere with your daily life routines, Eric, then I would just give the twins ways to cope and solve. So, if it's a battery thing, make sure that the child who is worried about it has access to batteries when they are, teach them to be calm and go and get batteries. Like, that's essentially what you want. If it is whatever else it might be, just teach them to have exercises. So in CBT, there's cognitive behavior therapy I was talking about, and for 8-year-olds, it might be too young for them to figure out their own thought process. But the second part of that is action. So it's like, can I change my thoughts? But in the meantime, what action can I do that will help calm me, soothe me, reverse my thought? That's a productive kind of good action that's going to help things. For instance, can I meditate when I'm calm? Can I do breathing exercises? Can I go for a run? Can I do something adaptive that will just take me out of that cycle of kind of OCD or thought pattern? So those are some of the things. I would just give your child some coping mechanisms, or actually even alter the environment in a way that might help them be more calm.
There we go. We have to say thank you to the amazing Amanda, who found the video and posted the link there.
Awesome,
so,
awesome.
Amanda, you kill me, Amanda. You're so amazing. And Amanda also says there are many more videos around this concept now, which I love. I want to get to Angie's question. Positive reinforcements. My son is 6, and it works wonderful for him, but I feel our life is turned into always having to use them to get anything done. And unless we use them, he will not want to do a lot of things that need to be done. He always wants the prize. I feel like I need to dial it back a little. What would be your suggestion? It originally started if he got an 8 at school daily, he got a prize on Friday, and that worked wonderfully, but it has gotten a little out of control. As to anything he does, he gets a prize.
Okay, great. So first of all, that's awesome, and very, very happy for you that you figured out that reinforcement works, and you figured out the reinforcers that are effective for your child. What you need to do is a token economy. And token economies are fantastic. And also, by the way, don't worry about it. Like, I had a token economy running for my kids for years. And if you think about it, everything in life is based on a token economy. Like, we go to work because we want to earn this token that's called money so that we can trade it for things that we want. So we live on a token economy. What you need to do is, and again, this is one of those things where there's tons of resources on how to set up a token economy. Look online. But you just basically want to list the things that you want your child to do, and then what he will earn for doing those things. And then it's a token, right? So it could be anything like a happy face or a sticker. And basically at the end of X number of stickers or happy faces, he will trade that in for something valuable. So by doing this, what you're doing is you're associating those tokens to the ultimate reinforcer, and you're making it so that your child starts to, this is important, the tokens now are delaying the reinforcers. So that means that you have to do this gradually. You have to do it right. There's a lot of stuff about a token economy. That's why I want you to watch some videos, look online and learn about it. Because if you spread it out too long, if you make it so that there's the work involved is too much to earn that one reinforcer, if it's not fair, then the child will give up. They won't be interested because the reinforcer just doesn't seem worth it, or it seems too far out. So that it needs to be like, right now it seems like it's a 1-to-1. I do something, I get a reinforcer. What you might want to do is, I have to do 2 things and I'll get the reinforcer, then 3 things and I'll get the reinforcer, and then you might want to increase the reinforcer if there are going to be 4 things. And so basically you'll start with one specific way to earn, so one chore or one task, and then gradually you could have multiple tasks. Now the beauty of a token, this is what I love about token economies, that it's not just about earning, it's also about response cost. So once you have the token in place, if the child does something that is not good, they can lose a token, and therefore you're now delaying their access to the reinforcer further. So it's really important, if you have a BCBA or someone who's behavioral, they can help you with this, but it is really important. And let me tell you, with kids, everything about the token economy matters. The way it looks, the size, where it is in the house, the fact that they can put the token on, everything matters. So doing this right will be life-changing for you.
I just remember all the times that our token economy would change. Like our team would make little Spider-Man buttons that were Velcro, and then it was like Mickey Mouse Clubhouse, and then it was Marvel things. I mean,
it's awesome.
It was fun. It's like the Underoos.
It is.
The fact that it's got something on it that they like makes a difference.
And also, especially when you start to get to a point where you're like working for something that's at the end of the week, that thing has to be visible.
Yeah.
So you need a big picture of the thing they're going to get at the end of the week. So that's really important.
When you get it right, it makes everything so much easier and fun. Just like things in our life. Like,
it's like life.
I think it's why we have holidays.
Yeah.
Honestly, because otherwise everything is Monday through Friday. Boy, didn't we see that during the pandemic? It was
Absolutely.
like, oh, it's another week.
Yes.
It was just everything the same. What are we working for? What are we getting out of life?
100%. If you think about it, Shannon, these things, like I now have a tracker on, these things are the fact that everybody wears an Apple Watch. That is a token economy.
Yes.
Like what it does is it gives you regular feedback as to how you're doing. And then at the end of it, it gives you like, oh, you have completed your circle. It means absolutely nothing that you have completed your circle, except in our mind, that complete circle has been associated enough times with health, with losing weight, with building muscle, with whatever it is, that when we see that circle, we just feel good. And that's what a good token economy is.
Saying hello to Daniel and saying hello to Autism Journey with Elijah. I want to go to Anisha's question, but I don't know if you had written in this question too, because we have 2 that are about nystatin, so I'm going to cover both of them. Anisha wrote, how long does nystatin die-off last? We are 2 weeks in, still very difficult.
Oh, interesting.
Should expectations be managed during ABA sessions? But we also had someone write in and say, we have started our biomed journey with our 3-year-old son using MedMap's doctor. He is being treated with nystatin for yeast and seems to have taken a step back. We're presuming it's die-off. Our BCBA didn't seem to think much about biomed in general, but otherwise we really like them. You're changing that.
I don't know. I've been trying to change that for years, and I just don't know if I can't
You have made inroads. I am promising you, you have made inroads.
Thank you.
Because I see a difference when I'm talking to BCBAs now where they're like, okay, that's a thing, and I want to pay more attention, and I want to know more about it. Where before, they always used to be like, not my thing, I don't care, I don't want to know, it's not. And you would go, you're treating a person.
Yeah. And our newsletter this week is all about biomedical stuff that interferes with behavior, interacts with behavior.
Of course.
But this is, so nystatin, actually I'm kind of surprised to be honest, because nystatin is one of the, I don't want to say weakest of the antifungals. It's not a very, very strong antifungal at all. In fact, it's so not strong that it can be used with newborns, right? I mean, it is the medication that we give when when an infant has thrush, which is the white fungus inside your mouth.
Yeah.
And they give nystatin. So it's kind of like, it's amazing to me that you're having such a strong reaction to it. You should continue, and every child is different. It might not be working if it's dragging on too long. Talk to your doctor. There are stronger antifungals depending on your child's age that can be given. Also, don't know what signs of yeast you're seeing. They give you different things for different yeast infections, or what are you seeing? There's lots of other choices. Nizoral, diflucan. There's other things you can try as well. It does take a little while. Yeast is not easy to deal with. You also need to look at diet, because your child might be eating things that are, at the same time as you're trying to control it with nystatin, you might be eating things that are increasing it. So you want to make sure that you balance everything out for yeast. And if you haven't, I think Julie Matthews, who's been on our show and is
She's
about
on
to
next
come.
week.
Yeah, she talks a lot about yeast, and she's
And
very, very
diet.
good. And die-off. So die-off can go on for a long time. It can be very short. It depends on the child, the level of yeast, what's going on, the treatment.
Yeah, I remember the first time that we did a yeast challenge, and it was 45 days. And I remember that very distinctly because everybody told me it would be around 30. And at 30, we were in hell.
Yeah.
And I was ready to stop everything because things got worse.
Yeah.
And it was great that I had a friend who was a midwife, and she explained die-off to me in a way that I had not heard it before.
Yeah.
And so then at day 45, I remember, and the distinct change in my child was huge. My child was not capable of sitting still for a minute.
Yes.
And I woke up on the day of the 45th day, and the house was quiet. And I woke up in a panic because I thought, oh no, what if he's gotten out? And went running out into the living room, and he was sitting quietly at the coffee table doing Legos by himself.
Yeah.
And when I tell you, I woke Jim up. I was like,
"Thank
something's
you."
wrong. Something's wrong.
Yeah.
What's wrong with him? And I came in the room, and I said, are you okay? And he looked up and made beautiful eye contact. That was what what
Yeah.
it meant for us on that day.
Yeah.
We still had to do a little die-off thing 2 more times because then we did B12 shots and it kicked up the yeast.
That's awesome.
But I would ask you to say to your BCBA, because
that's that whole side of
you
it.
have funded for BCBAs to find out more about this.
Yeah.
Can you talk about that for 2 seconds?
Sure, yeah. So I made an investment with the Association for Behavior Analysis. I gave them a bunch of money a few years ago, ABAI, and I asked, for that donation, they made an endowment in my name, which is based on the multidisciplinary approach to treating individuals with autism. So it's all about, every year at the national conference that occurs where thousands of BCBAs, the largest conference for BCBAs, there is a speaker that is someone I invite who's a physician who will go in and speak about biomedical issues. For instance, gastrointestinal issues, lots of different things that have to do. We've had several really, really good speakers so far. Jim Adams, lots of good people have spoken, but and so the idea is to start to acclimate and train BCBAs and teach them the concept of all the biomedical things that go on with our kids, because obviously if you don't know the medical things that are happening with a child, you're just going to ignore them, and one should never ignore them. It just makes no sense logically. Like, if you think about it, if the BCBA is thinking of your child as a human being, they cannot ignore anything medical that's going on with a child. If they're not sleeping, you can't ignore it. If they have yeast issues, if they have allergies, dietary issues, sensory issues. Think about it. Like, whoever it is, like if it was themselves. I always tell BCBAs, I'm about to do another set of lectures for our BCBAs, but I always tell them, how do you feel on a day when you haven't slept? How do you feel on a day when you have a lot of allergies? How do you feel if your stomach is bothering you? And the child feels that way, and you have to that has to be a low demand, high reinforcer period of time. You just have to think about that.
We need to crochet that and put it on a pillow.
Yeah.
Because I feel like that is a piece that not everybody has. And when we get into other discussions, which we were talking about before, that's a piece that's missing.
Yeah, no, because people take it very personally, and they think, like, if my child takes a step back today, if my patient takes a step back today, that means I've done something wrong, and as a behavior analyst, I need to push further. You know, it's just wrong thinking.
It's not fair.
Yeah,
I'm going
it's
to
not
get
fair.
T-shirts made
Right.
that say it has to be fair.
has to
I'm
be
going to
fair.
get that made. I promised Renee I would get to this question because she says, I so enjoy Autism Live and ask Dr. Doreen, thank you for all your help, your empathetic approach, and warmth of your caring, which comes out in every session. My question is whether you know about the subject of fecal transplant and treatment of children with ASD.
Yeah.
I know of one research paper from 2019, but there doesn't seem to be follow-up research.
Right.
Also, I'd like to know whether or by whom and where this procedure might currently be in practice and whether or not your listeners have experienced it. I'm looking forward to every one of your broadcasts, and bless you, Dr. Doreen. That's from Renee.
Thank you so much, Renee. And it is funny because I just mentioned the person who does the fecal transplant research. That is Dr. Jim Adams, and he's at ASU, Arizona State University. He did the research that was published in 2019, and it was a big deal. Now, from a theoretical perspective, we should all know and be aware. Nobody tells you this, but the truth is, we all have lost the healthy bacteria that we need in our guts, in our gastrointestinal system. We all have, because of years and years of having genetically modified foods that are covered in pesticides and so on and so forth. The reason, let's put that aside for a moment, many of us, I mean, for those of you who are as old as I am, you might remember that 20 years ago, you wouldn't turn on the TV and have 50 different commercials about prebiotics, probiotics, and so on. Nobody even knew what a probiotic is. Now, everybody is on some form of probiotic, right? You have to ask yourself, why is that? And that is because the bacteria in our gut, we're trying to replace the healthy bacteria, because when that healthy bacteria is replaced, we're digesting better, we don't have bloating, we don't have reactions to foods, and et cetera, et cetera. Now, when a good friend of mine who was a very famous chemist used to say that when you take prebiotics or probiotics especially, in order to replace that healthy bacteria, it's as if you were trying to populate a beach by putting handfuls of sand. Okay, so just think about that imagery, right?
Yeah.
In other words, the amount of bacteria in a probiotic that we take is so minimal that it's not really all that effective. We can take that probiotic pill for the rest of our lives, and if our bacteria is completely gone, if the environment of our gut, if the biota of our gut is so completely depleted of healthy bacteria, you could be taking probiotics forever and it's never going to fix things. So the way to really fix things is to actually implant those bacteria into your gastrointestinal system. How is that done? Theoretically, for many years, everybody has known the way to do that is to transplant fecal matter, poop, from a gut that is, or from a colon that is very, very healthy. So fecal matter that does contain all the healthy bacteria. Now, obviously, there's a lot of danger involved in that, right? Because you are populating someone's gastrointestinal system with fecal matter that could potentially lead to a lot of other issues, right? Other types of bacteria, other types of infections, et cetera, et cetera. So this paper that was published, it needs to be replicated, and Jim Adams is actually in the process of replicating. In fact, they recently reached, I have contact with Jim Adams. He recently reached out. They are doing additional research. It is very expensive. They're trying to get more funding to continue this research. Theoretically, in my opinion, it is something that works, theoretically. But in order for anything to become something in practice, it needs to be replicated multiple times. It needs to be approved by the FDA. There's lots of things they have to go through still. So if anyone knows of the possibilities, it would be Dr. Jim Adams at ASU. You can reach him. I'm sure he's online. He's in LinkedIn. And that's where to go.
But people do this just not for autism.
You do it for celiac and other very, very severe gastrointestinal disorders.
It's not a new thing.
No, not at all. Not at all.
Amazing. Okay. Autism Journey with Elijah. Thank you. They like my hair. But no, I'm not getting ready for the podcast-a-thon. I promised myself and Dr. Granpeesheh that there would be no podcast-a-thons. Not in that way. Not in that way.
Yes,
we're not,
yes.
I'm still recovering from the 44 hours last year.
Yes.
This year, we're just trying to do lots of great shows with lots of great content, and we're putting out the calendar for the shows early. So by the end of this week, there will be a calendar for the whole month.
Yes.
It's amazing, the guests that we're going to have on. But no, the hair was not for that. The hair was because I couldn't stand it anymore, and I just, and I didn't wait for you. I should have waited for you.
I know. I came and I was like, you didn't let me shave it.
You can shave my head anytime you want to. But I do want to get to her question, which was, is DeGeorge's syndrome and 22q deletion, are they common with autism? I was told that they are and that there is no cure. It is also common to misdiagnose. This is where we're at. My son is getting tested. There are 5 levels of testing with chromosomes. We're on level 2, very nervous.
Yeah. This is a good thing in that we're starting to, there's a lot more testing done on chromosomes to identify the genetic disorders that have symptoms that resemble or are identical to autism. So what we're finding is that you have this title called autism spectrum disorders, and within it there are genetic disorders that have already been identified, and there are more and more as time goes on, people are identifying these genetic disorders. Now, because what happens is, typically autism is diagnosed based on symptoms. So it's not a typical thing to do when you have a child who's diagnosed with autism to go and check their chromosomes. I'm very happy now that there are people who are starting to actually do a lot more genetic testing because it has become so easy to check. So much easier. Right? Now, a lot of people have started with just things like 23andMe, but realistically, you could also there's an organization that we're talking to called Linus Bio, and they don't even do a buccal swab, which is, like the 23andMe, I think, is spit. Yeah. And what they're doing is they're analyzing the spit inside your mouth, which is fine as well. Others, or maybe 23andMe is blood. I don't remember which one is it. No, it's spit. It's spit. So there's obviously there's tests that can be done for metabolic disorders, genetic disorders with a finger prick, which is awesome. Linus Bio also does it based on a hair strand. Love that. Which is really good because they're looking at older stuff in the body as well. When you look at hair follicles may hold on to things. But it is entirely possible to, and I know it's a process, but keep going. And don't look at it as if he has this chromosomal difference, that means we can never teach him to adjust his behavior, or that means that it is what it is. It's not. A lot of chromosomal issues exist, but the child can still learn and can still adapt and can still thrive. So don't think of, just like I tell parents, don't think of the diagnosis of autism as it is, and for the rest of his life he's going to be this way. That's not true. It's a diagnosis, and you can also teach this individual a lot of things that are going to help them thrive. Same thing with chromosomal issues.
There we go. I also want to note, we're out of time, but that you notice that the address is the same for Autism Care Today as it is for, we're suites right next to each other.
Yes.
You can't see because there is a green wall here, but if I go over and open the door, it breaks the green wall, and that is the entrance so that we share space with
Oh,
Autism
did somebody
Care
ask
Today.
about? Yeah.
Yes, they said
yeah.
we've been referring people to Autism Care Today, and they
Oh,
knew
nice.
our address, and so wonderful. Amanda says, and this will be the last thought for sure, my daughter has Rett's syndrome, and we still do biomedical, and it works. It's not the end.
That's right.
Be all. You can still, there's still plenty to do. Yes, sending you all hugs. And Autism Journey with Elijah said it really enlightens us about who he is and how to handle it head on.
Yes.
Absolutely. Knowledge is power. All right, you guys, we are out of time. And of course, I cannot remember who our guest is tomorrow. So you're going to have to tune in. It's a surprise. I remember it's somebody good. Tune in tomorrow and you will see. And tomorrow we'll unveil a lot of who the guests are for the month of April. So, and we're putting out the calendar by the end of the week. So make sure that you're with us for that. But thank you for this. This is
I had
so
pleasure.
enjoyable.
So much fun.
All right, we'll see you tomorrow. Until then, give your kiddos a hug from me and one for you too. Bye-bye for now.
Bye, everyone.
Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time. We hope to see you there.